Hello everyone. You probably think baking soda is harmless, but here's the shocker. According to the US National Poison Data System, more than 5,000 cases of baking soda medical emergencies were reported in a single year, many involving adults over 60 who used it for so-called natural healing. By the end of this video, you'll understand why 7 health problems might disappear, but 5 more dangerous ones could appear, all from something as simple as a teaspoon of baking soda. So if you're over 60 or love someone who is, hit like, share this video, and don't forget to subscribe to Healthcase. Let's get started. Number 1. High sodium leads to worsen heart failure or hypertension. Hey, let's talk about something that looks harmless but can quietly push your heart to the edge. Baking soda. Just half a teaspoon of it might not seem like a big deal, but what many seniors don't realize is that tiny amount contains over 600 milligrams of sodium. That's nearly half of the daily limit recommended by the American Heart Association for people with high blood pressure or heart failure. And here's where things get serious. When you already have a weak heart, adding that much sodium can make your body retain fluid. Your heart has to pump harder. That's when swelling shows up in your ankles. You feel tired walking across the room. Your blood pressure spikes even when you've taken your meds. Some folks over 60 drink baking soda water thinking it'll ease their digestion, but what it's really doing is putting stress on an already fragile system. And the worst part? You won't feel it right away, until the symptoms hit. If you've got a history of heart failure, high blood pressure, or fluid retention, this is a red flag. Skip the home remedy, follow proper senior health tips, and check with your doctor first. And if you ever feel chest tightness, sudden weight gain, shortness of breath, or lightheadedness after using baking soda, don't wait. Call your primary care physician or a cardiologist immediately. If you thought it stops at blood pressure, think again. Your kidneys may be the next in line. Let's talk about how baking soda quietly adds pressure where you least expect it. Number 2. Kidney damage. If used frequently or in large amounts, it's easy to think, I've been drinking baking soda for years and I feel fine. But when it comes to your kidneys, no news isn't always good news. Damage can build up slowly, quietly, until one day, things just don't work the way they used to. Here's the deal. Baking soda shifts the balance of acid in your body. That might sound helpful, but your kidneys are the ones stuck fixing that balance every single time. According to the National Kidney Foundation, 1 in 3 adults over 60 has kidney disease and doesn't even know it. Add baking soda to that equation, and you're forcing weak kidneys to work even harder. Over time, that can lead to symptoms like swollen feet, foamy urine, or feeling more tired than usual. And in severe cases, baking soda can cause a condition called metabolic alkalosis, where your blood becomes too alkaline. That's when you might notice confusion, muscle twitching, or nausea. If you're living with diabetes, high blood pressure, or already have some level of kidney decline, this is a red flag. Baking soda isn't just a home remedy, it's a stress test for your kidneys. One of the smartest senior health tips out there: never treat kidney issues on your own. If you've been using baking soda regularly, talk to a nephrologist, a kidney specialist. They can help you catch the damage before it becomes permanent. Seen signs of swelling or fatigue after trying a remedy? Type 2 if kidney health is on your radar. Number 3. Medication absorption interference. Let me ask you something. Ever taken your pills, then washed it down with a glass of baking soda water? It sounds harmless. Maybe you've seen someone online say it helps digestion or boosts energy. But here's the part they leave out. Baking soda can actually block your medicine from working. See, when you take medication, especially pills that need an acidic environment to break down, your stomach has to be just the right level of acid. But baking soda is alkaline. It neutralizes that acid. That means your medicine might dissolve too slowly, too fast, or not at all. WebMD and clinical pharmacists have warned that baking soda can interfere with medications like antibiotics, heart pills, and drugs for thyroid or diabetes. The problem? Many seniors take these daily, and the effects are invisible at first. You might think your medicine just isn't working like it used to, but really, it's being blocked before it even enters your system. That's dangerous, especially if you're managing chronic conditions like high blood pressure, cancer, or irregular heartbeat. Here's one of the most practical senior health tips. Always wait at least 2 hours between taking baking soda and any prescription drug. Or, better yet, don't combine them at all without checking with your doctor or clinical pharmacist. And if you've been feeling off lately, even though you're doing everything right, talk to your provider. The issue might not be your body, it might be the baking soda. Worried about mixing meds? That's just one piece. Now imagine pressure building up from inside your stomach. What's coming next might surprise you. Number 4. Gastric rupture from gas buildup. Alright, feel bloated after dinner and reach for baking soda? You're not alone. Lots of folks over 60 drink it to settle the stomach after a heavy meal. But there's something most people don't realize. When baking soda meets the acid in your stomach, it creates gas, and lots of it. This isn't just a little burp we're talking about. The chemical reaction produces carbon dioxide, which builds pressure fast. And if your stomach is already stretched from food or slow digestion, that gas has nowhere to go. According to reports cited by emergency physicians, there have been real cases of stomach rupture, literally tearing after people drank baking soda too soon after eating. The risk goes up in older adults, especially if you already have digestive issues, weak stomach lining, or take anti-inflammatory medications. You might feel extreme bloating, sharp upper belly pain, or even have trouble breathing. These aren't symptoms to sleep off, they could mean your stomach wall is at risk. Here's a key senior health tip. Never take baking soda immediately after a large meal. And if you feel bloated and uncomfortable, try walking or sipping warm water instead. But if you ever feel severe stomach pressure, sharp pain, or nausea that comes on fast after using baking soda, don't wait it out. Go straight to the ER or call your doctor or a gastroenterologist immediately. That reaction can happen fast, and in some cases, it's life-threatening. If you've ever felt uncomfortably full after using baking soda, type 4, so we know we're not alone. Number 5. Confusion, weakness, and electrolyte imbalance in older adults. Do you ever feel shaky for no reason? Or maybe forget what you walked into the room for? Most people chalk that up to aging, but if you've been using baking soda regularly, especially without talking to a doctor, there might be more going on than just getting older. See, baking soda changes the balance of acid and fluids in your body, and for seniors, whose systems already process slower and are more sensitive to salt shifts, that can quietly lead to something serious: electrolyte imbalance. Studies have shown that excessive or repeated use of baking soda in adults over 65 can lead to low potassium levels, hypokalemia, shift the body's pH too far, metabolic alkalosis, and strain the muscles and nervous system. This can manifest as symptoms such as confusion, weakness, fatigue, or lightheadedness, even if everything else seems normal. In more advanced cases, severe electrolyte imbalances can cause irregular heartbeats, arrhythmias, or difficulty walking. The hard part? These symptoms creep in slowly. You don't get a warning light. One day, it just feels harder to get up, to think clearly, or to stay steady on your feet. That's why one of the most overlooked senior health tips is this: don't ignore mild confusion, fatigue, or weakness. And don't assume it's just your age. If you've been using baking soda more than occasionally and notice these changes, call your primary care doctor or an endocrinologist. Your body might be sending a signal it can't balance itself anymore, and at this age, balance is everything. Feeling weak and foggy isn't the end of the story. Let's shift gears. And look at how baking soda actually can help if used the right way. Number 6. Relief from heartburn and acid reflux. You're lying in bed and that burning sensation hits your chest again. It climbs up your throat, keeps you awake, and makes even a sip of water feel like fire. For many older adults, acid reflux is a nightly visitor, and baking soda seems like an easy fix. And to be fair, it does work in the short term. Baking soda is alkaline. When it hits the acid in your stomach, it neutralizes it almost instantly. That's why so many people reach for a glass of water mixed with half a teaspoon of baking soda. Relief comes fast. But here's where senior health tips come in. This is a short-term solution, not a long-term answer. Using baking soda too often or in large doses can lead to sodium overload, bloating, or even kidney strain, especially in adults over 60 who may already have high blood pressure or digestion issues. If you only get heartburn occasionally, a small amount might help, but if it keeps coming back, don't treat the smoke and ignore the fire. Your body might be trying to tell you something deeper about your diet, medication, or underlying health. And if you need to reach for baking soda more than twice a week, it's time to check in with your primary care doctor or a gastroenterologist. Relief is good, but real care means getting to the root. If you've ever tried baking soda for heartburn even once, give us a 6 down below. Number 7. Slows CKD progression, chronic kidney disease. Could something as simple as baking soda really help your kidneys? That's what some studies suggest. And it's true, but only in the right hands. When your kidneys are weak, they struggle to remove acid from your blood. That leads to a condition where your body becomes too acidic, which puts more stress on already tired kidneys. Baking soda, being alkaline, can help neutralize that acid and, in some cases, slow the progression of chronic kidney disease, CKD, GLCS. But here's the part that often gets left out. This only works when carefully monitored by a nephrologist, a kidney specialist. In studies where patients benefited, the dose was prescribed, adjusted, and monitored through regular blood tests. It wasn't just someone adding spoonfuls to their water every day. Using baking soda on your own, without lab work or supervision, can cause the opposite effect. Too much, and it disrupts fluid balance, blood pressure, and makes your kidneys work even harder due to the high sodium content. That's why senior health tips from medical professionals stress caution, not casual use. If you have CKD, don't take baking soda unless your kidney doctor recommends it and provides specific dosing instructions. And if you notice swelling, changes in urination, or unusual fatigue, it's time to check in with your doctor. Baking soda might offer support, but without a doctor's guidance, you're guessing with your health. And after 60, your kidneys don't guess well anymore. So yeah, baking soda might support your kidneys, but only when it's part of a plan your doctor actually signs off on. And when you look back at everything we've covered, it's kind of a mixed bag, right? On one hand, you've got quick relief from heartburn, maybe a bit of help with oral health, or even some support in managing inflammation. But on the other hand, if you're not careful, it can quietly raise your blood pressure, strain your kidneys, mess with your medication, and leave your body off balance. Bottom line, baking soda isn't good or bad. It's just powerful, and power needs guidance, especially after 60. If you found this helpful, make sure to subscribe to Healthcase. We've got more practical, straight-talking tips just like this, so you can stay strong, stay safe, and take control of your health every day. But don't worry, this doesn't mean you have to throw out the box completely. Baking soda can still be useful even after 60 if you know how to use it the right way. Let's walk through that together. Number 8. Use baking soda occasionally for heartburn relief. Proper dosage. You've just had a big tasty dinner, but now comes that familiar burn. It's that rising hot feeling in your chest that makes even lying down uncomfortable. A lot of older adults turn to baking soda for quick relief. And honestly, if you use it the right way, It can help. Baking soda works because it neutralizes stomach acid. But here's the key. You only need a small amount, just 1/4 to 1/2 teaspoon dissolved in a full glass of water, and sip it slowly. That's it. Don't go overboard, and definitely don't use it more than twice a day. Also, timing matters. If you've taken medication recently, especially blood pressure pills or thyroid meds, wait at least 2 hours before using baking soda. The acid in your stomach helps certain pills absorb, and baking soda can block that if used too close together. According to senior health tips from digestive specialists, baking soda is fine for occasional use, but not as a daily fix. If heartburn becomes frequent or comes with sharp pain, coughing, or nausea, that's your cue to talk to a doctor. Used the right way, baking soda can calm the fire without lighting another one inside your body. It's not about avoiding it completely, it's about using it smartly. So now you know how to take it safely, but what if you're doing it often? This next part is where your doctor really needs to be in the loop. Number 9. Talk to your doctor before using baking soda regularly. Let's say you start every morning with a glass of baking soda water. Maybe it's for digestion, maybe it's something you saw on a health blog, and you've been doing it for weeks or even months because it feels like it's helping. But here's the thing. If you're using baking soda more than once or twice a week, it's not just a home remedy anymore, it's a routine. And anything you do regularly to change how your body works, that deserves medical oversight. Baking soda affects more than just your stomach. It shifts the pH of your blood, your urine, and your digestion. It also interacts with common medications. And if you're over 60, your kidneys, heart, and electrolyte balance can be more sensitive than you think. Regular, unsupervised use can lead to serious issues like metabolic alkalosis, high sodium levels, and potassium imbalances, which can be particularly dangerous for older adults. That's why one of the most overlooked senior health tips is this. If baking soda is part of your weekly routine, talk to your doctor. Let them know how much, how often, and why. They may recommend blood tests to monitor your electrolytes and kidney function, or adjust your other medications to make sure there's no hidden risk. What helps today might hurt tomorrow unless someone's keeping an eye on it. And no matter how natural something sounds, it still needs to work with your body, not against it. So go ahead and ask. That one conversation might save you a lot of trouble later on. If you've talked to your doctor about any home remedy before, type 9, your experience matters. Number 10. Never mix baking soda with other remedies without guidance. Seen one of those online recipes, just mix baking soda with apple cider vinegar and drink it every day? It sounds like a healthy combo. Both are popular, both are natural. But here's what no one's telling you. Mixing them together may do more harm than good, especially for older adults. When you combine baking soda, which is alkaline, with vinegar or lemon juice, which are acidic, they react, and that reaction produces gas, a lot of gas. If you drink that too soon after eating, it can create pressure inside your stomach, causing bloating, discomfort, or even worse in people with weak digestion. Plus, these ingredients don't just cancel each other out, they may also interfere with how your stomach digests food or absorbs medications. For someone over 60, especially with heart, kidney, or digestive issues, that's a dangerous game to play. The sudden release of gas can lead to severe discomfort and, in rare cases, complications like gastric rupture, as previously discussed. According to senior health tips from registered dietitians and medical professionals, you should never mix baking soda with other home remedies or over-the-counter medications without first consulting a doctor or pharmacist. What seems harmless can react in unpredictable ways inside your body, potentially leading to adverse effects or reducing the efficacy of medications. And remember, just because two things are natural doesn't mean they belong in the same cup. One good thing plus another doesn't always equal better. Sometimes it equals trouble. So check with your provider first. Your stomach will thank you. Think mixing things is harmless? That's where it starts. But it's how your body reacts that really tells the truth. Here's what to watch for. Number 11. Watch for side effects and know when to stop. Ever feel more bloated than before after taking baking soda? Or maybe just a little more tired than usual, even though you slept fine? It's easy to ignore those signs, but sometimes they're your body's way of telling you, hey, something's off. Even when you follow the instructions, low dose, occasional use, baking soda can still cause side effects in older adults. That's because after 60, your body doesn't regulate fluids and minerals the same way. Things like bloating, nausea, muscle weakness, or swelling can sneak up if your system doesn't respond well. These symptoms are often related to the sodium content and the impact on electrolyte balance. Experts warn that these mild symptoms can lead to bigger problems if you keep using baking soda without realizing what's happening. Especially if you have heart, kidney, or digestive issues, small changes matter. That's why one of the most practical senior health tips is this: if something doesn't feel right after you take baking soda, even just once, pause and pay attention. Don't keep going just because it worked before. Think of it like your body tapping you on the shoulder, and if the signs get stronger, shortness of breath, chest discomfort, confusion, it's time to stop and call your doctor. If it doesn't feel right, it probably isn't. Listen early, act early. That's how you stay ahead. If it felt a little off after trying something natural, tap 11 in the comments if you've noticed side effects. Number 12. Prioritize product quality and freshness. You open that orange box in the back of the cabinet, it's been there for years. No smell, no label, maybe a little clumpy. It's just baking soda, you think? It should still work. But here's the truth. Even something that simple can turn dangerous if it's old, damp, or stored wrong. When baking soda absorbs moisture from the air, it starts to break down. That means it may not neutralize acid the way it should, or worse, it could grow bacteria or mold if it's been exposed to humidity. And if you're using it in water to drink, that's not something you want entering your system. Especially for seniors, whose bodies react more strongly to imbalances or irritants, freshness matters. Always check the expiration date. Make sure it's stored in a cool, dry place with the box closed tightly. If it's been open for more than 6 months, especially near the stove or sink, it's time to replace it. And if you're not sure where it came from or how long it's been open, don't guess, it's not worth it. One of the most practical senior health tips is this: treat your baking soda like your medicine. Fresh, clean, and safe. Or don't take it at all. It only costs $1, but if it's spoiled, it could cost you much more. So yeah, keeping it fresh and clean might sound like a small thing, but for your body, especially after 60, it makes a big difference. And honestly, that's the heart of everything we've talked about. If you're using baking soda to ease a little heartburn, that's okay, just keep the dose low and the timing right. If you're using it more than once in a while, bring it up with your doctor. Don't mix it with other things unless someone who knows your health says it's safe. And if your body starts feeling off, even just a little, listen. Baking soda isn't the enemy. It just needs a little respect. Use it wisely, and it can still be part of your routine, the safe kind. And while we're talking about using it wisely, here's one more thing a lot of folks overlook. If you're using baking soda to freshen your mouth, that's actually a smart move. It helps reduce bacteria, balances mouth pH, and even soothes gum irritation. Especially helpful for seniors with dry mouth or dentures. But here's the catch. Don't swallow it. Seriously. A lot of older adults swish and then gulp without thinking, especially if they mix it with warm water and honey or salt. Over time, that small habit can add up to hidden sodium intake, and for people with blood pressure or kidney issues, that matters. A quick rinse is fine, just half a teaspoon in a cup of warm water, swish for 30 seconds, and spit it out. And even that, keep it to 2 or 3 times a week max. It's one of those senior health tips that seems too simple to be important, but it really is. Sometimes it's not about what you take in, it's about what you don't. So yeah, sometimes it's not about cutting things out completely, but about learning how to use them right. Those small changes we just talked about, they could save your heart, protect your kidneys, and help you sleep better tonight. All from adjusting how you use something as common as baking soda. The truth is, baking soda isn't good or bad. It's what you do with it that makes the difference. Used the wrong way, it can quietly harm your body, but used wisely, with the right dose, at the right time, it might just ease your symptoms and give you a little peace of mind. So take care of yourself, get your checkups, stay hydrated, and listen when your body speaks. And if this helps you or someone you love, don't forget to hit like, share it with a friend, and subscribe to Healthcase. We've got more smart senior Sinclair health tips coming your way.